I started at Graceland University right out of high school. Then I went on to graduate school at University of Kansas, and I had the privilege of being able to come back and teach part-time at Graceland. And I was teaching the day I had this event and had just put up a slide talking to the students, my nursing students, about what happens if you get a blood clot in a coronary artery or any of the arteries. And then I had this severe chest pain. I thought, well, I'll just step away for a little bit, take some Gaviscon, thinking it was indigestion.
I have been with Centerpoint for 3 years. She casually mentioned that she was actually instructing her students about ischemia and talking about the symptoms, and she became pale and diaphoretic, and her students were just confused at what was going on because they were literally talking about it, and she's going into this.
All right, we're calling 911. And then the fire captain got on, they ran the EKG, and she said, we're taking her to Centerpoint, she's having a STEMI. And then rolled into the ER where there were several nurses going, Barb, Barb.
I was one of her students in nursing school at Graceland University. I was just waiting. We knew they were coming in by ambulance and waiting for the arrival. And there was a moment and I just said, Barb? And I heard her go, Carrie? And my heart sank.
So I went to Graceland and I had Barb as one of my instructors. So went straight to the ER, opened the door, and I already see Maggie and I see Carrie. They were like, Tony, it's Professor Voshall. And I'm like, Barb.
I am an interventional cardiologist, so that means I focus on doing procedures on the heart, especially people who are having heart attacks. The type of heart attack that she had is one where one of the arteries to the heart is completely closed. And so we received her right in the emergency room as she arrived, and we were able to get her immediately to the cardiac catheterization lab, go in through her wrist and open up the artery using balloons and stents.
And I chuckle because she continued educating us as we're walking down the hall, talking about medications and symptoms and all the textbook symptoms that she had that were classic for someone having a heart attack.
After I had the procedure, I went up to ICU where there was one of my other previous students was my nurse and got superb care.
She got ICU care and then step-down care as well as cardiac rehab care. And all of those pieces have a really important role in a patient doing well.
I absolutely love our ER. We are a family. We are a family with our first responders. We work great together. There's no place I would rather be.
One of my favorite metrics to talk about is the door to needle time, which is the time it takes from the patient rolls in through our cath lab doors to the time the physician starts the case. And consistently our time is 8 minutes or less.
This case really reinforces how important the whole team, from the recognition to the cath lab and then recovery, how important that whole chain is.
I mean, everybody that we see is someone that somebody loves and cares for on the table. And I think it's a good refresher and reminder of the seriousness and the weight of what we get to do every day.
To see the evolution and how happy I am that Centerpoint is one of the leading cardiac care centers in our area and possibly in the United States. So I truly appreciate it.